When you apply to the College of Registered Nurses of British Columbia to register as a nurse, you may be asked to complete a Substantially Equivalent Competency, or SEC assessment. We want you to be successful in your application, but we know that nursing practice is different around the world. So, before you can be registered, we want to identify any areas where your nursing knowledge and practice may not be the same as in BC and where upgrading may be required. The SEC assessment is required for the majority of internationally educated applicants before they can be registered with the CRNBC. This short film is intended to provide information about the SEC assessment, explain how it works, and what to expect. After you have been referred for an assessment, CRNBC will contact the BC IEN Assessment Service, who will send you an email to explain what you are being referred for. You will be asked to reply and indicate when you would be available for an appointment. Then you'll be given a date and time mutually convenient for both you and the assessment service. Assessments take place in the Greater Vancouver area, so if you need to go through immigration to come to BC, you should resolve this before making an appointment. Please contact Immigration Canada for the most current information related to your situation. CRNBC will provide you with a letter of invitation if required. This is where you'll be registered for your assessment. Please arrive 15 minutes early in order to complete the check-in process, as there will be other applicants taking their assessment on the same day.
Hi, welcome to the IEN Assessment Service. Here for your SEC?
Yeah. You must bring a government-issued photo ID at the time of check-in, or you will not be permitted to proceed.
Perfect. There you go. You can just have a seat over there and we'll be with you shortly.
You will be able to access the washroom during your exams. No mobile phones or bags are permitted in the assessment areas. You will get a break for lunch, and there is a cafeteria on campus which you can access on your break. The SEC assessment is designed to evaluate your professional knowledge, nursing skills, and abilities against what we expect from a newly graduated nurse in BC. You will not be assessed at the expert level. As well as a general nursing assessment, there are focused assessments in specific areas: maternal newborn health, pediatric child health, mental health. CRNBC may require you to go through an assessment in one or all of these areas. One assessor conducts the assessment and another marks the written exams. A report will be completed at the end of the assessment, which will be sent to the CRNBC within 3 to 5 weeks. It is important to know that the assessor does not know anything about you or your nursing experience and won't give you any feedback about how you are doing during the assessment. The SEC assessment uses 5 strategies to evaluate the competencies of registered nurses: written diagnostic exam, triple jump assessment, clinical judgment assessment, objective structured clinical examination, or OSCE, and self-assessment. All components of the SEC are timed, and candidates have to be able to read the instructions and complete the required tasks within the time allowed. The written diagnostic part of the assessment is conducted on computer in a room like this. This section is made up of 2 sessions: short answer questions and multiple choice questions. This part of the assessment tests the theoretical nursing knowledge expected of registered nurses in Canada. If 2 written assessments are required on the same day, you will get a break between sessions. These short answer and multiple choice questions can take up to 7 hours with a break between the 2 parts. You don't need to bring any writing materials with you, as you will be provided a calculator and scratch paper, which will be collected at the end of the exam. No talking is allowed in the exam writing room. The triple jump assessment, as the title suggests, is divided into 3 areas: identification of client issues, selection of relevant interventions, and identification of evaluation strategies. This is an interview conducted by the assessor in a room like this. You will be presented with a brief client situation and asked to generate a problem list about the client's situation, identify and collect relevant data, revise the problem list based on the collected data, develop a management plan, and self-evaluate. This process is designed to assess knowledge, problem-solving abilities, critical thinking, organizational client assessment and self-evaluation skills, plus self-directed learning abilities. The Clinical Judgment Assessment is an interview-style assessment that will evaluate your ability to make sound clinical judgments in situations which have no simple answers. These situations will assess your ability to think deliberately and methodically through a nursing situation, apply essential and appropriate knowledge, consider the options, and take appropriate actions. This part of the assessment is conducted in a room like this, where you will get to demonstrate your nursing practice and respond to client and family health situations. There will be a real person acting the client role. You will be observed at all times by an assessor who will be taking notes. They are not permitted to encourage, coach, or instruct, and can only repeat instructions 1 or 2 times before having to move on.
How would you describe the pain?
Sharp sometimes.
Before you begin your OSCE, you will be shown the room so that you are familiar with your setting. You will have an opportunity to ask your assessor about any equipment that you might be unfamiliar with. However, the assessor is not permitted to demonstrate how to use the equipment, only to answer any questions you may have. As there is a time limit for each portion of the OSCE, your assessor may give you time warnings to help you move along in your assessment. The OSCE is used to assess the following knowledge and skills: nurse-client interactions and relationships, critical thinking and clinical judgment skills, health assessment and nursing skills, ethical decision-making skills, pharmacology and pathophysiology, rapidly changing patient situations, and delivery of nursing interventions and evaluation. The self-assessment component is a tool that allows you to write about your own nursing experience and is a chance to identify areas of strength and growth opportunities. Self-disclosure is expected, and while you may feel uncomfortable identifying areas for development, this is common practice in Canada. The assessor may compare the self-assessment to the other data gathered in other parts of the SEC. This will help to determine if you have a full understanding of the expectations and are able to identify areas for development. The assessor is looking for consistency between your self-assessment and other aspects of the SEC. What happens next? After you've finished your SEC assessment, it will take between 3 to 5 weeks for a report to be completed. The IEN Assessment Service then sends a report to the college. We review your report and documents and make a decision about your eligibility. The decision will be sent to you by email. Please remember that CRNBC staff is available to discuss your application for registration and next steps with you.